There are new questions tonight about a medication used by millions of women every year to help with morning sickness. Diclectin is one of the most popular drugs used to treat nausea during pregnancy. A study out today, though, suggests there is no definitive evidence that it really helps. In fact, it shows that modern mothers-to-be have been relying on 40-year-old information. CTV's medical specialist Avis Favaro has that story.
When pregnant women suffer morning sickness, doctors often prescribe this, Diclectin, to ease nausea and vomiting. But this researcher has unearthed unpublished original data on the drug and says there were so many flaws, there's no proof it actually works.
It's disappointing that this information that was generated in the 1970s is only being made publicly available now.
Some 2,300 pregnant women were enrolled in the 1975 study, which was never published. The new analysis found data was missing or incomplete, and over a third of the women never finished the study.
This trial was the main basis for Health Canada's decision that the medication is effective. Health Canada's decision to approve this medication should be revisited.
But in an email to CTV News, Health Canada officials say they reviewed all of the research on Diclectin last year, with no new safety or efficacy issues identified. The drug's maker writes, "We have complete confidence in the safety and efficacy of Diclectin, and Canada's Society of Obstetricians and Gynecologists will continue to endorse it."
If they need drug treatment in addition to other methods to help them with nausea and vomiting in pregnancy, that the drug Diclectin is assuredly safe and quite effective.
Jen Madden has been on sick leave for the past month because of nausea and vomiting, and yes, she takes Diclectin, though it hasn't stopped her symptoms. She says she has no other option.
I don't know how effective it is, and the way that I feel and the way that morning sickness impacts me, I'm at this point going to keep taking it.
This new discussion about Diclectin is part of an international effort to take a closer look at old or unpublished research. The goal is to give doctors and patients more information about the drugs they are using. Avis Favaro, CTV News, Toronto.
Just over a year ago, the U.S. Food and Drug Administration rebuked the drug maker when reality TV star Kim Kardashian endorsed Diclectin on social media to her 100 million followers without proper warnings about medical risks. Kardashian was ordered to delete those posts.